नमो आयर्याणं नमो वजायाणं नमो लोये सवसाहुणम् एसो पंचनमोकारो सव पावपनासनो मंगलानंचे सर्वेसन् परमं हवै मंगलम् परमं हवै मंगलम् நீராறும் கடலுடுத்த நிலமடந்தை கெழிலொழுகும் சீராரும் வதனமென திகழ்பரத கண்டமிதில் தெக்கணமும் அதிர் சிறந்த திராவிடனர் திருநாடும் தக்க சிறு பிறை முதலும் தரித்தனரும் திலகமுமே அத்திலக வாசனை போலனை துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திறம்பியந்த செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
A pleasant afternoon to one and all. A woman can make a difference, but together we can rock the world. With a positive note, it is a moment of great privilege, honor for me to extend a hearty welcome to all of us today at this memorable webinar on Women's Health and Hygiene Awareness session. It's indeed a great pleasure and honor to have Dr. Jayashree Gajraj, a senior consultant and Department of Obstetrics and Gynecologist at Apollo Hospital. She had also participated in various health awareness TV programs for women in last 10 years. We welcome you, ma'am. I'm sure that we are going to carry a lot of knowledge and learning from you, ma'am. Last but not least, a warm welcome to teaching and non-teaching staffs, college management, and students. Thank you for your presence today. I humbly request our chief guest to carry on the session.
Jayashree ma'am.
Hello.
கேக்குது ma'am. Okay.
Yeah. Do we go ahead, ma? Any other?
Okay. No. இல்ல. Okay.
Give me 2 minutes while I share the screen.
Okay, ma'am.
You can basically see my mail, Ilya. So, are you able to see it, ma?
Okay.
Okay, right. Is it okay?
Yes,
Okay, ma'am.
Yeah. So, a very warm welcome and good morning to all of you.
Morning.
I think today is indeed an extremely special day, and one of the WhatsApp messages I got today said, today may be March 8th, maybe officially the Women's Day, but every day is a Women's Day, and I think that's very, very true. So I'm happy so many of us have got together today, and let's go through some of the health issues that we may actually feel as we go through our lives, right from childhood through the the ages when we have children, when we have a family, and then the menopausal period. So a little bit today, I think this year, as all of you must be fully aware of, the theme is choose to challenge. And every year they've been changing the wordings a little bit, but it's always revolving around gender equality. And yesterday we had a meeting when somebody asked me, and I said, I don't know why we are trying to strive for gender equality. We already have it. Why are we thinking we are one step below and wanting to achieve that one step above us? We are equal and we are together, and that's the way we should be. So what the International Women's Day message is that A challenged world is an alert world. And I think there's no doubt at all about this. Individually, we are all responsible for our own thoughts and actions every day of our lives. And we can all choose to challenge and call out to gender bias and inequality. We can also choose to seek out and celebrate women's achievements. So, unless we highlight and celebrate the achievement of great women, we're not going to be inspired. And if we are not inspired, we will not aspire to reach greater heights. Need not necessarily be in gender equality. We can reach greater heights in our own fields as well. And this is the message that was given for the International Women's Day 2021 by the UN Women Executive Director. I am not going to attempt to pronounce the name, but what she has told us is that we need women's representation that reflects all women and girls in all their diversity and abilities, and across all cultural, social, economic, and political situations. This is the only way we will get real societal change that incorporates women in decision making as equals and benefits us all. So this is, I think there's a lot of messages in this few sentences, and this is what we should take forward. Coming back to our own field, or rather what I would like to talk to all of you about, because you know that for a woman to be a whole, she needs to be mentally, physically, culturally, family wise, everything. She needs to be happy. So we need to be fit as a fiddle. There's an old English idiom which dates back to the 1600s, and all it means is good health. So what happened? Why this? Because globally, if you look at this, the population, the of age 60 years currently is about 580 million. That is 20. This currently was a couple of years ago, 2020, 1 billion. And we're talking of 75% of this is the elderly population. And 50% of the women in this age group are postmenopausal. So we can look at the phenomenal rise that you can see. Percentage increase is about, compared to 1999, 2050, we are expecting 240%, which means each and every one of us is going to live longer. But I know we always say we don't mind how many years we live, but we want to be healthy. Can that health be looked after only at the age of 60 or 65? Definitely not. We have to start taking care of our health right from our early young days. And I have so many young women with me today listening to this. So this is the message that I want to give. Now, before we start talking about good health itself, we should be able to define it. I don't know how many of us can define good health, but maybe it's one way of looking at it is absence of disease. But it is much more than that. Disease need not enter into this definition at all. Good health is good health. That is, every aspect of your body and your mind is working well. Can we quantify it? We can't. Because again, as I said, there are so many factors involved that we cannot put a scoring system and say, I've done this scoring sheet, I'm 80%, I'm 60%. No, it doesn't work that way. And as I have repeatedly said, it's physical and mental health, not or mental health. And as healthcare providers and as people belong to the society, can you and me assure 100% good health to all the women around us? We cannot, but we should. So we asked, when we ask for women's perception of their greatest health problems, it is surprising that many of them actually spoke about breast cancer, and another 27% spoke about other cancers. So this kind of takes up a major part of the circle, doesn't it? About 16% don't know, no answer. Other problems, 16%. So these are all very, very small. And only 7% said cardiac disease, which meaning any kind of medical disorder, only 7%. So in reality, what is it? It's not all those things that people were thinking about. It is diabetes, it is hypertension, arthritis, which is not uncommon, heart disease, osteoporosis, which is actually weakening of the bones. And as we live well into our 80s and 90s, we have this problem with memory loss that is known as dementia, Alzheimer's disease, and more popularly known in colloquial terms as brain fog. There are other day-to-day worries that we think about, and these are: do we have a vaginal discharge? Do we have any itching below? Do we have any of the symptoms that many women go through before their periods are due? Like, for example, the heavy feeling, the bloated feeling, breast pain, mood changes that they may have. Menstrual irregularities, again, not at all uncommon. Women who are married may not have an interest in sexual life, and they may not even express it to others. But this is and can become a serious problem. So that is loss of libido. As women grow older, they are unable to hold their urine. They are not able to, when they laugh or sneeze, they will leak urine. When they want to reach the toilet and try to hold on to that urine, many of them will actually leak urine before they reach. Weight gain, a problem across the ages. When we are much younger, we don't bother about it. As we go into our late teens and early 20s, we want to look beautiful, so an incentive to lose weight. But as you grow into your late 20s and beyond, we have a vested interest in your weight gain. So we have to also watch out this weight gain. So what we will do today is we'll discuss some common conditions, and then I'm quite happy to take questions at the end. But I hope somebody will let me know about the time when we are about at least 30-35 minutes into it. Now, the commonest condition that we see women coming to us with is vaginal discharge. Now, it may be common, but many are worried that it is a sign of cancer. Because if you Google, you will find one of the signs of cancer is vaginal discharge, but they don't qualify it. Predominantly, vaginal discharge that most women get is normal, or what we call physiological white discharge. It can become a pathological discharge when it is either very thick, when it is discolored, when you have itching along with it. Sometimes the discharge may be curdy white precipitates can be there. That again is an indication of infection. And when any of these things happen, along with itching in the lower part of your genital tract, that is the labia and what we call the vulva, you have to go and see your doctor. But any kind of excessive clear discharge, especially mid-cycle, no need to worry at all. So there is a definite entity called normal vaginal discharge, and then you have the abnormal, which you need to go and see your doctor about. And generally, I would say young and unmarried girls who are sexually not active, there is no need to worry about vaginal discharge at all. PCOS, yes, a household term, I would say, and some even very affectionately refer to it as Pcos and PCO. There are a number of things, but I'm sure many of you who are listening to me today can identify with many of these things. The weight gain, which we're not able to lose despite all our efforts, the acne that may come up either on the cheeks or on the lips or anywhere, the hair loss as we keep combing our hair and brushing our teeth, and then what about the irregular menstrual cycles? So PCOS affects 1 in 10 women, which is quite a big number actually. And you will see 10% of women in the childbearing age, 50% of women with PCOS actually go undiagnosed. And then 50% of them will go on to develop diabetes in later life. 4.3 billion estimated annual cost to the American healthcare system to diagnose and treat PCOS. Now, that's a huge amount. 3 times the increased risk of women with PCOS developing endometrial cancer. Now, these are just facts, but I do not want all of you to start thinking that if you have PCOS, you're going to develop endometrial cancer or you're going to develop diabetes. You may is what they are trying to say. And we can definitely control our PCOS so that we do not land up with these things. So this again is a different way of expressing all the symptoms of PCOS, because it's actually a syndrome. It's polycystic ovarian syndrome. So we spoke about all this hyperandrogenism, which is actually the male representation. We get acne, we get oily skin, we get the male pattern of hair loss, the cardiovascular, the heart issues, menstrual irregularities. So these are all different aspects. And then 2 important things which are not addressed are that some women can actually go in for depression and some can actually have sexual problems as well. And because of all this, the poor women put on so much of weight, they're not able to lose weight. Obviously, all of us want to look good. There's no reason why we shouldn't. So, for that, one of the key factors is losing weight. So, but it's a lifelong disease. So, when people ask us, if I have a 6-month course of any tablet that you may give us, doctor, can it be cured? Should I do a scan at the end of 3 months or 6 months? And will the little cysts on the ovary disappear? Unfortunately, no. And fortunately, there is no need for it to go, because these little cysts are nothing but a reflection of the hormonal imbalance. So it is an ultrasound finding. We do not have to take treatment to make it disappear. So it may be there on some scans, it may not show. But what you can do is, by losing weight, you can correct the hormonal imbalance, and therefore you can actually make those cysts disappear on the scan. And I will put that in inverted commas, because as long as hormonal imbalance is there, these cysts will appear on the scan. So there is no cure, but you can certainly control it. And control will depend on what we want. Now, do we want to get rid of the andro, that is the male type of symptoms like acne, hair growth, etc.? Are we trying for a baby when the treatment is different? Do we have diabetes when the treatment is again different, heart disease, etc.? So this is from 15 years all the way to 55 years. So they can actually manifest at any age. And the treatment actually mostly would be guided by the age of the woman, as we said, because the need of the women at different ages is different. Depending on what she wants, we can tailor the treatment according to it. And as we do this, because you come to us with a symptom, as we do this, we keep the long-term effects, the complications in mind, like the diabetes, the blood pressure, the cancer. So we also try to take care of that, and we will counsel you about this. So one of the mainstays of treatment is lifestyle modification. Reducing weight, maintaining your BMI is very important. So this is in a sense, the treatment for the PCOS. The next common thing that many people see, and I'm sure many of your mothers, you would have heard that they may be having fibroids. Fibroids can give rise to heavy bleeding during your periods. They can give rise to pressure symptoms. You may not be able to control your urine. You may not be able to pass motion freely. They can give rise to heavy bleeding, severe pain, and these are all the various symptoms. So if especially a fibroid is like this, pointing into the cavity, it can also give rise to little spotting during your cycle. So the treatment for fibroids, depending again on the age group, if they have completed their family, we tend to go more towards removing the uterus itself if the fibroids are symptomatic. If they are not symptomatic, there is no need to do anything. They just come back every year for a repeat ultrasound scan and review of the woman. Now, if they have not completed or they're trying for a baby and they have this huge fibroid and symptoms, then we do what is called a myomectomy, where we remove the fibroid alone. So the treatment will vary depending upon the age of the patient, the symptoms they have, and whether they want to have a baby or not. So it's either wait and watch, don't do anything. We can treat heavy bleeding and pain, and surgical treatment where we feel it is going to make a difference to the to the future of that particular woman. Heart disease, you may not believe it, but there is one death every 8 seconds around the world because of heart disease. And more women die compared to men. We may be hearing of more men, but once we cross that threshold called menopause, actually we tend to be more prone for the heart disease. So is it because we have missed the risk factors? So these are the various risk factors for heart disease, and we have to keep it in mind. And when any of us fall into any of these risk factor groups, then we need to take care of it. So this is again to tell you it's the number one killer of women. As you said, as we saw earlier, people thought it was cancer, but it's not. It actually causes 1 in 3 women's death each year. And 1 in 5 women believe that heart disease is their greatest threat. But we know that they think of cancer much more than what we do. And we all have, each and every one of us will actually be able to fall into one of those risk factor categories. Moving on to the next important or the next medical disorder, which is so common, It is actually endemic in India, opposed to the pandemic that we have gone through last year. Diabetes is endemic. It is here in our country. It is here amongst us. And when you look at this, close to 62 million, and by 2025, talking of 70 million. And then just another 15 years later, it's going to rise to 355 million. I mean, these are phenomenal increase and phenomenal numbers, which can easily be controlled. How do we control it? You, all of you at this young age, when you are in your 20s, please try to take care of the food that you eat. And this plate concept, or the 9-inch plate, is a very important and nice way of assessing what we can eat. So this is like 1/4 with whole grain or starchy vegetables, small amount of fresh fruit, lean protein. If you're a non-vegetarian, if you're a vegetarian, you can certainly take, sundal or verkadale. There are a number of other protein sources that we can look into, and fill half the plate with non-starchy vegetables. And here again, I wouldn't really go for this carrot so much. We have a lot of very tasty and lovely Indian vegetables, the native vegetables. I would actually fill half the plate with that. So this is the kind of diet you should all be taking, but make it enjoyable, make it tasty. But this is what you should take right from your young age. Moving on to the next very important condition called osteoporosis. Now, older women and men in our houses, you know that they need not necessarily have a fall. They can just hit themselves, their hand against the cot in the bedroom or against the wash basin, and you know they can develop a fracture. This is because the bones actually weaken, and this condition is called osteoporosis. 1 in 2 Indian women above the age of 45 suffers from this, but they will not be symptomatic because it is called a silent disease. Now, we said earlier about women living longer. So, of the women who are living longer, 50 million women are at risk of osteoporotic fracture. So that again is a huge number. So when the bones become weak, what happens? A young girl who's standing straight, and a woman, then slowly starts bending forward because the vertebral column is not able to take that weight. There is a shift in her center of gravity, and that is why, which makes her more comfortable, and that is why she starts leaning forward. And this is known as the dowager's hump. Fortunately, we don't see too many of these. When I was a child, in much younger days, we have seen quite a lot of women walking about like this. It's very, very sad to see them because they are not enjoying the world as you and I do. So we have to prevent this. So how can we prevent this? Prevention begins again in childhood, so which is much earlier than the age group that all of you belong to. So what happens? Stay active. Do not become a couch potato. Start some kind of weight bearing exercises. You may be playing games, or you can do some exercises. Try to increase calcium in your diet. Definitely, you must drink milk in the younger age, but as we grow older, we start supplementing with calcium. Avoid caffeine as much as possible, alcohol, smoking. Some of you may say, why is she talking about this to a group like us? I think it is my duty to talk to a group like this because we are definitely seeing people more and more of alcohol consumption, more and more of smoking among girls, which I think doesn't mean that you should not, be with your peers. You should not be up to date with your peers, but at the same time, keep the long-term consequences of these habits in mind. Try to sit out for at least 15 to 30 minutes in the sun every day between 12 and 2 in the afternoon. Mental health, again, a major issue. The WHO says there is 1 suicide every 40 seconds globally. Now, this is not women alone, but men and women put together. And it's, again, a huge number. So why does this happen? Because I think women go through a lot of problems which they don't actually talk about. They keep it to themselves. And it can be a girl in her 20s also. It need not necessarily be a woman with 100 problems of her family, her husband, her in-laws, or whatever problem she may have. So we can overcome this by developing certain habits right from our young age, so that when there is a chance of depression setting in, chance of any mental health problem setting in, we are ready to face it by developing a positive attitude, the healthy diet that I told you already, regular exercise, by having some form of prayer, whether you believe in God, whether you don't believe in God, in prayer or not. there is some kind of inner reflection that you should do. That is also called meditation. Start developing some kind of hobbies so that your mind can concentrate on these, and you will never ever stray towards the problems that one has when going for depression. So, what about cancer? We spoke about this right in the beginning. Definitely, it is not a death knell. The common cancers in women are breast, cervix, which is the mouth of the uterus, endometrium, which is the inner lining of the body of the uterus, and the ovary. We have two ovaries on either side of the uterus, which actually starts giving, is responsible for the egg formation, and this is what develops into a baby when we have the ovulation every cycle. So the disease of cervical cancer, because cervical cancer is the commonest cancer in women, next only to breast. And both of them are actually running a race neck to neck. So we have such a huge number. This is a 2012 estimate that we had. And on an average, about 70 to 80,000 new yearly deaths from the disease itself. So it is something that we need to definitely take care of. And it is said that 1 out of 4 women who died due to cervical cancer in the world is an Indian. Another startling figure that has been put forth on and off is that every 7 to 8 minutes, there is one woman dying in India of cervical cancer. So we started talking, I think, about 15, 20 minutes ago or a little more. So just calculate how many women we have lost due to cervical cancer in India because they did not have the access to good healthcare. They were not aware that this particular cancer can be prevented if they go early to their doctor because they did not have the facility to have a test called the Pap smear. Is that disturbance? Thank you. So fortunately for us, this cervical cancer is a preventable disease because it has a long preclinical phase. Now, what is a preclinical phase? If the cancer starts today, for it to become apparent to the doctor or the patient looking at it, it will take a certain length of time. It can be 5 months, 6 months in certain cancers, but in cervical cancer, it is anything from a few years to 17 to 20 years. So we actually have a long opportunity to pick it up. It can be picked up in the stage before cancer develops. And we have a very good, simple test that can be used to pick up this cancer. And there are umpteen treatment modalities which are easily available with, unfortunately, there is a lack of awareness. So many of you would have heard of this Pap smear or the cervical smear, and this is to identify cells in the precancer stage. We generally advise this vaccination once in 3 years for people who have normal smears, but in certain groups, we may do it more frequently, or if we find an abnormality, we may ask for earlier review. So whenever an opportunity presents, please undergo the Pap smear. Most of you would have heard about this cervical cancer vaccine or the human papillomavirus cancer vaccine. Now, we're actually fortunate that we know majority of these cancers are caused by a virus called human papillomavirus. So a vaccine has been developed, and ideal age to give it is before the marriage or at 10 to 15 years, along with the vaccination schedule for children. It is part of the Indian Association of Pediatricians vaccination schedule. So it gets given like your MMR or your diphtheria or any of these vaccines. It is one of the vaccines that is given. So we normally have 3 doses. And when we do this also, we should still go for the Pap smear regularly. Breast cancer, again, very, very common. Second leading cause of cancer deaths in women. But as I told you, cervical cancer and breast cancer keep running a race all the time. In India, 60% of breast cancers are detected at advanced stage. Again, extremely unfortunate because we have a test which can pick it up when it is literally 1 or 2 millimeters in size. And when we pick it up at this stage, we are talking of 100 or 200% cure for breast cancer. So why are we not taking up this test? And what is the test? Now, simple things. Yes, there are families where breast cancer runs in families. So, and there are some women who are at higher risk of developing breast cancer. People who are on hormone therapy, not necessarily the hormones that are given to you in your 20s and 30s, but this is the hormone therapy that we give after menopause to replace what we have lost after our ovaries stop functioning. Now, you yourself can look for breast cancer changes, early changes. When we see a lump, we've already missed the bus. So we have to look for skin changes, rashes, any kind of discharge from the nipple. Is the skin pulled in at some point or the nipple pulled in? So these are various things that we need to look for. Any of these signs does not mean cancer. It is only an alert sign for you to go and see your doctor immediately. So the screening tests, as we told you, one is the self-breast examination. The other is the examination by your doctor. The third is the mammogram. The mammogram is something that women shy away from because all social media reports the mammogram as very, very painful. Now it is actually nothing but a slight pressure on each breast to take 2 views of x-rays where the breast is actually compressed for literally 10 to 12 seconds and then released immediately. Now this compression is required to get clarity. And as I told you, 1 or 2 millimeter lesions to be picked up, we need clarity. So this is the only reason why the breast is compressed. Now, it is not at all painful. And if we perceive it as painful, it is worth that pain, because if we diagnose something early, we can completely obviate the pain that one would get from a full-fledged breast cancer. So please don't shy away from it. Go for the test. Generally, after 40 or 45 years of age, once in 3 to 4 years is more than enough. If you belong to the high-risk age group, then your doctor will advise you whether you need to go for it on an annual basis or not. The other two are the uterine and the ovarian cancers, which are easily picked up. When you have a uterine cancer, it invariably results in bleeding. So women present to us early. Now, the ovarian cancer, again, unfortunately, all over the world is diagnosed at a very late stage. So these are two cancers, but we don't have very effective screening methods for these. So how can we help? What can we do? We need to go every year for what is called a preventive health check, which kind of, it cannot give you 100% assurance that everything is fine with you, so don't worry. It cannot do that, but it is very useful to pick up some small problems that may come up, and when we find it, we can definitely try to sort it out at that stage itself. And if there is any indication that a disease may come, we can try to prevent it. And cervical cancer is one of the key examples of this. So this is what I would advise. Consult your doctor first. Don't go for the health check directly, because each health check is tailored to suit the needs of a particular woman. So meet your doctor, let her or him examine you, and then tick off the indicated tests for you. And then you go and have it and go back and see your doctor. So that is the ideal way of doing the annual health check. So these are the different things. So that final aim is to get holistic approach to ensure good quality of life. Because many of these health checks I have seen for women in their 30s, 40s, 50s will not have a pap smear, or will offer mammogram only as an additional test. So when that happens, women tend not to take it. So that is the reason why meet your doctor first and then try to take up what you think suits you. We've all been through this pandemic, and there is no need for me to re-emphasize this. Yes, numbers are certainly increasing. So please be careful. Try to follow all these key points every minute, every day in your life, so that we can certainly prevent the rising numbers. Their numbers are certainly rising. Vaccination is available. Please do not again shy away from vaccination. Do not believe all the horror stories that are going around on social media. Vaccination is our only salvation. So please go and take the vaccination. It does not matter where. Please go and take it. That is a fervent appeal that I would make to each and every one of you.
கேமரா ஆன் பண்றது
Of
எதுவுமே
course,
பண்ண பட்டன் உட்காருங்க
the youngsters, your eligibility may come up a little later, but when your turn comes, please go and take it. I myself have taken 2 shots of the vaccination already. So being International Women's Day, I know all of you are sitting at home. I want each and every one of you to strike the pose. This is the pose, either your left hand or your right hand. This is called the choose to challenge pose. I want each and every one of you to hold your hand up. This is one way of showing our commitment as women to choose to challenge. Okay, there are challenges that are always there, but we have to make that choice. We have to convince ourselves that we can definitely work and we can do great things as women. So this is a commitment that all of us are doing. So to challenge inequality, call out against bias, question stereotypes. A woman can do only this, a woman cannot do that. Why not? There are women truck drivers nowadays. That was the latest on the social media. So why not? And let us all help to forge ahead to get what we would love to see, an inclusive world where men and women live together. So thank you very much. Definitely, I think every cloud has a silver lining. We are moving towards better times with the COVID well under control, and every cloud has a silver lining. So thank you. Stay safe. Please continue to stay safe. I'm happy to take questions as they come.
Thank you, ma'am. ரொம்ப நல்லா இருந்தது மேம் உங்க பேச்சு. நிறைய சொன்னீங்க. தேங்க்யூ மேம். பல்வேறு பணிகளுக்கு இடையில நீங்க வந்து எங்களுக்கு பேசினது ரொம்ப சந்தோஷமா இருக்கு மேம்.
இது வந்து ஒரு பணியே கிடையாதுமா, இது டியூட்டி. இட்ஸ் மை டியூட்டி.
இருந்தாலும் இப்ப உங்களுக்கு எவ்வளோ வேலைகள் இருக்கும், அதுக்கு இடையிலேயே எங்களுக்கு 1 மணி நேரம் டைம் ஒதுக்கி எங்களுக்காக ஸ்பெண்ட் பண்ணதுக்கு ரொம்ப ரொம்ப நன்றி மேம். கொஸ்டின்ஸ் யாராவது இருந்தாக்கா கேளுங்கம்மா.
They can put it in the chat box if they want, or they can.
அக்ஷயா ஆர் அக்ஷயா
I think says one is how can we prevent it, ma'am, but they have not said what.
கேன்சரை பத்தி சொல்லிட்டு இருக்கும்போது கேட்டிருந்தாங்கன்னு நினைக்கிறேன்.
Akshay, I think she says how can we prevent it. As I told you, all cancers cannot be prevented. Breast cancer can be detected early. Cervical cancer comes under the group of preventable cancers. So cervical cancer வந்து நம்மளால இந்த pap smear டெஸ்ட்டுக்கு போய் நம்ம ஏர்லியா கண்டுபிடிச்சோம்னா, ப்ரீ கேன்சர் ஸ்டேஜ்ல கண்டுபிடிச்சோம்னா கட்டாயம் நம்மளால அதை வந்து கண்ட்ரோல் பண்ண முடியும். But மற்ற cancers எல்லாம் we are talking even today of what we call early detection.
ஓகே, thank you மேம். கேர்ள்ஸ் வேற யாருக்காவது क्वेश्चंस இருக்காமா?
See, again, this is an example. We all feel shy to ask questions. I think this is an example again, Women's Day. We have to move ahead. So, is a lump in the breast, is it common? Very good question, because which I probably should have mentioned, because having such a beautiful young group of girls with me today, you will get lumps in the breast as youngsters. Now, these are known as fibroadenomas. These are not cancers. Okay, they are small cysts. Now, why do we have growths at all anywhere? We don't know. Nobody has found out yet why a tissue grows. Like, why does a nose grow to a certain length and stop? Why is your ear only this size? Something in the body says it's grown, so stop. So in the message or this policing, when that doesn't take place, the body grows beyond its limits, and that is when you get a growth or a lump. So most lumps are not cancer. So they will grow up to a point and stop. So these lumps in the breast in younger women are called fibroadenomas. So mostly என்ன பண்ணுவோம், 3 centimeters கம்மியா இருந்ததுன்னா we don't do anything. We just say come back in 6 months, come back in 1 year, and we keep watching it. But 3 centimeters மேல போச்சுன்னா it is better to remove it, because breast cancer can be present even in a 24 or 25-year-old. So we have certain criteria, அதை வச்சு நாங்கள் டிசைட் பண்ணுவோம். But otherwise, younger age group lumps, very unlikely cancers. You don't have to worry. The next question is, PCOS, can it lead to cancer? Very rare, but part of PCOS is that endometrial cancer that I told you. When we don't control the hormone imbalance, uterus lining, that is endometrium, you can get cancer. PCOD and PCOS, PCOD is an old term. That is polycystic ovarian disorder or disease. But now we refer to it only as PCOS, that is polycystic ovarian syndrome. PCO அப்படின்றது ultrasound appearance. Okay. When does the PMS start during the menstrual cycle? And can you please tell us? Yeah. So PMS into the premenstrual symptoms. So premenstrual symptoms itself means roughly about a week prior to the periods, because a lot of hormone changes are taking place in our body. Now these hormone changes are secondary, that is after the egg formation or ovulation aana udane there are hormone changes. So these hormone changes are basically meant by nature to get ready for the baby that may come in. Okay, so nature பொறுத்த வரைக்கும் it is only interested in producing children and trying to அதோடைய offspring, அதோடைய species வந்து procreate பண்ணணுன்றது தான் அதோடைய main source. So when that happens, it's getting ready. In the hormones nala, we can have severe breast heaviness, breast pain. Sometimes even when they don't wear a correct size bra or they don't support their bra well, they can have pain. So it can be very distressing when you're working, when you're in the middle of many people. This pain can be very distressing. The other thing is the bloated feeling. Now some girls or women go in for mood changes. So what happens when this happens? Suddenly they'll feel like crying, or somebody who's very close to them normally would pass a comment and they won't react, but in the premenstrual period they get upset, they go and cry, or they will shout back. So you can get mood swings. So many things can take place in this premenstrual syndrome. So one second, I think we've just gone up. Let's see.
Oh, ma'am, shall I read the questions for you?
Yeah, I've got it. Side okay. The lumps formed under the skin, which are non-movable, cause itchiness. I'm not sure what Madhubala is referring to. So let's just. Can Madhu qualify that, Ma?
Madhubala?
I'm not sure what in particular you're referring to.
Ma'am, if a person has got operated a lump from the breast, and now that person is again finding 2-3 lumps, small lumps all over the body.
Yeah.
They are not movable, ma'am. But they are causing itchingness. Is it dangerous?
It may not be related to the breast lump at all. You have to go and see a dermatologist, Ma, because lumps causing itching is not common. Usually you'll either have a rash that can cause itching. So if there is a definite lump, it has to be seen by a doctor. We cannot dismiss it as nothing to worry about. Okay. So the other thing is,
if the lump is bigger than the 3 centimeter which you described, ma'am,
that is inside the breast, not in the skin. Under the skin is different. You're talking of in the breast tissue.
Okay. On the hand, ma'am, on the hand.
Hand, then you have to go and see the doctor, ma. You have to see what it is.
Okay, ma'am. Thank you, ma'am. So much helpful, ma'am.
Ma'am, how to improve women's bone health? So the things that I told you are making sure that you are active. You have to do weight-bearing exercise, walk, run. You can do your stretches also. And after, like say 30, 35, you can start taking calcium as a tablet every day. So this can definitely help to build up your bones from the younger age group. Is it advisable to genital? Good, again, a very good question, which I should have mentioned. We do not advise any of these so-called vaginal washes or douches, or, which is like fills the supermarket shelves. There is no need for any of this. Just use simple soap and water, whatever you normally use. If your skin is dry or prone to become dry, use a soap with a conditioner. Otherwise, there is no need for anything. Some soaps, like glycerin-based soaps, actually dry the skin. So try not to use that. Otherwise, simple soap and water is all that is required. Can PCOS be cured? I think I did answer that. It cannot be cured. It can certainly be controlled. Does eating food cooked in non-stick tawa cause? I don't think so. I don't think that is there's enough scientific evidence for that, because years together all of us have been eating in food cooked from non-stick vessels only. So I don't think that's true. That should not be true. What is meant by PCOS, ma'am? Again, we have explained quite in detail. Menstrual cups, good. I'm glad somebody has asked this. Menstrual cups, if you are able to handle it, if you are able to use it well, it's extremely good, generally advisable, because one, it avoids the use of sanitary pads, which can cause a lot of local reaction, lot of itching, and the need to change pads sometimes, especially once you all finish your college and go to work. You will find that changing a pad becomes a major issue. It's not at all easy to, as a working woman, to go and change your pad at regular intervals. Whereas these menstrual cups are good. Early days, we were getting menstrual cups which needed to be cleaned and reused, but now we have disposable cups. So the only factor here is your comfort level in using the cups. If you're comfortable, by all means, I would actually advise you to go for that. We were able to know cancer last stages, but why are we not able to know at the earlier stages? This again has been partially answered by me. We have to go for regular checkups to our doctor, because only the doctor will be able to look for certain common cancers. Again, we cannot diagnose all cancers. There are certain common cancers which give us an opportunity to diagnose early. So when these cancers can be picked up, we can certainly, pick it up early and try to cure or treat them completely. What do you think of facial hair growth? I think it was meant to be growth. Facial hair is a very, very distressing problem for young girls, because, as we said, late teens, 20s, everybody wants to look good. It is part of the PCOS syndrome. We can certainly help people with facial hair. So it will, a combined treatment with a gynecologist and a dermatologist will go a long way in treating the facial hair. How to reduce protein for 65 years for my grandmother? See, normally at 65, what kind of a diet they are taking. This applies more to people who are die-hard non-vegetarians who take a lot of protein, because they cannot handle that high level of protein. So that is when we say cut down on the protein. So not that they... Yeah, thank you. So that is, that's the way to reduce the protein, not that they need to avoid it already. This vitamin D deficiency, again, is a very, very common thing which goes around, because mostly all the tests show that vitamin D is less. Now, if we find single-digit numbers, we treat women with single-digit numbers. But people who are, like, say, 20s or 30s in the value of vitamin D, there is no need for taking vitamin D. You can actually supplement by going out in the sun, or taking, diet, or you can do this. There's no need, because actually calcium and vitamin D go together.
Sorry, ma'am.
Yes, ma'am. Go ahead.
Ma'am, sorry for the disturbance, ma'am.
Yeah, tell me.
Questions நிறைய வந்துகிட்டே இருக்கு. நமக்கு டைமிங் ரொம்ப கம்மியா இருக்கு மேம். நமக்கு 1 hour தான் போட்டிருக்கோம் Zoom link.
Okay. If somebody can actually pull out these questions and mail it to me, I'm quite happy to answer it. If you want it to be done. Technically, if one of you can pull it out and, mail the whole thing to me, I'm sure I can certainly help you. Okay? Is that fine?
Yes, ma'am.
So thank you very much. I've enjoyed being with all of you. I hope it's been useful to you.
Thank you, ma'am. Thank you, ma'am. Sibita?
Thank you, ma'am. Thank you so much, ma'am.
Sibita?
Yes, ma'am.
Continue, ma'am.
Yeah. I would kindly request Aparna to deliver her vote of thanks.
Good afternoon to everyone present here. All the good things come to an end, and so is the webinar. I am Aparna Venkatachalam, Department Secretary for Department of Corporate Secretaryship Shift 2. On behalf of Sri Shankarlal Sundarbai Shashwan Jain College for Women, I take this opportunity to propose the vote of thanks. I would like to express my sincere gratitude towards our guest speaker, Dr. Jayashree Gajraj, for having taken a time out from a busy schedule for the sake of enlightening us with her knowledge. Today's webinar was full of knowledge and was extremely interesting. It gave us deep insights into the topic and also revealed some new, though shocking facts. Thank you so much, ma'am, for answering all the questions so patiently. I am pretty sure that the knowledge you've imparted to all of us shall definitely help us in the upcoming times. I would also like to take this opportunity to place my record a hearty thanks to the Apollo Shine, the college management, our principal, Miss Padmavati ma'am, the vice principal, Miss Rukmini ma'am, for the enthusiastic support. A special thanks to all the teaching and non-teaching staff for their support and coordination. Last but not the least, I would also like to thank the students present here for their active participation. Thank you, ma'am.
Thank you.
Let's end our session with the national anthem.
जनगणमन अतिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जाहे तव शुभ आशीष मांगे गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you, ma'am. Hello.
Yes, ma'am. Thank you. Thank you so much.
Thank you. Thank you so much, ma'am. Very interesting session, ma'am. நிறைய இன்ஃபர்மேஷன்லாம் கொடுத்தீங்க. ரொம்ப ரொம்ப தேங்க்ஸ், மேம்.
Thank you. Welcome.
Thank you, ma'am.
Thank you, Dr. Jayashree.
Thanks, Indra. Thank you. I didn't realize you were on the group. I saw your message.
Thank you so much. Happy Women's Day to you.
Thank you. Same to you.
And to everybody here.
Thank you, ma'am.
Okay.
Once again. Bye, ma'am. Bye, ma'am. Thank you. தாமரை